NCLEX question strategy. 4 steps to success. Let's master the test together. Do NCLEX questions make you feel like every answer could be right? In this video, I'll give you a simple, repeatable way to pick the safest answer every time. We'll decode what the question is really asking, run it through a clear priority ladder, know exactly when to assess versus act, and use smart elimination so you're never stuck. By the end, you'll have a mini playbook to answer any NCLEX-style question with confidence. Let's jump in. The NCLEX isn't testing trivia. It's testing safe, priority-based nursing judgment under pressure. The wording can be tricky, but the patterns are predictable. I'm giving you a 4-part method you can use on any question. Decode the STEM, run the priority ladder, decide, assess versus implement, and eliminate traps. Main point 1. Decode the STEM so you know exactly what's being asked. Before you even look at the answers, spend 5 seconds purely on the STEM. Who is the client? What setting or timeline matters? Are they asking for the first, best, or most important action? Or is it a negative question using except? Then rewrite the question in 7 words or less. Ask yourself, what kills first? What do I do first? What is unsafe? This clarity is your step 0. Example. A client 2 hours post-op with SPO 292, RR 26, and pain 8 out of 10. Reword it. Fix the breathing first. That's your target. Main point 2. Use the priority ladder. This is your sequence for decision-making. ABCs, then Maslow, then acute versus chronic, and finally ADPIE. Step 1. ABCs. Airway, breathing, and circulation beat pain or teaching. Step 2. Maslow. Physiologic needs like oxygen or glucose come before anxiety or loneliness. Step 3. Acute and unstable beats chronic and stable. New confusion beats baseline dementia. Unexpected findings always beat routine care and priorities. Step 4. ADPIE. Always think, assess before implement before notify, and always evaluate your results after you intervene. For our post-op client, raising the bed improves breathing now. Pain is important, but not before airway. Calling before acting delays care. The best answer is A. Main point 3. Assess versus implement. This is where most students get stuck. When do you gather more data, and when do you just act? Assess if you lack focused data, but if the client is in immediate danger, implement a life-saving action first. If you already have clear data that demands action, act. Triggers to act immediately: airway obstruction, severe respiratory distress, active bleeding, anaphylaxis, or a transfusion reaction. Safety can't wait. Think about a client receiving blood who develops fever and chills. Your first action? Stop the transfusion. That is immediate safety before further assessment. What if a client with an NG tube reports nausea? Assess the tube's patency and placement first. Don't jump to meds before confirming the cause. Main point 4. Eliminate like a pro. Learn to spot the NCLEX traps and the scope of practice limits that lead to the wrong answer. Eliminate absolutes like always and never. They're usually wrong. If 2 answers are opposites, 1 is often right. And always respect the scope of practice. RNs handle evaluation, assessment, and initial teaching. UAPs handle routine, unchanging tasks on stable clients like vitals or ambulation. Don't delegate judgment. Always choose the least restrictive and least invasive safe option first. Try repositioning or distraction before moving to meds or restraints. Which can you delegate? A is assessment, B is teaching, C requires judgment, D is a routine task with a stable client. That's the winner. Eliminate and win. Let's bring it all together. Success on the NCLEX isn't about guessing, it's about a disciplined path to the safest possible outcome. Decode and reword. Run the ladder. ABCs, Maslow, acute over chronic. Choose assess versus implement using the threat rule, and eliminate with scope and safety in mind. If you can name the priority and its core safety rule, you can answer any question with confidence. You're becoming the nurse you were meant to be. If this helped, hit like and subscribe. Tell me in the comments which step you'll practice first, or drop a question stem you're stuck on and we'll walk through it. Next, watch my rapid fire practice where we apply this method to 15 questions in under 10 minutes. See you in the next lesson.